Hello there, welcome to another video. As of the date, the 1st of February 2021, we've had approximately 50 million vaccine doses distributed here in the United States of America, and approximately 32 million doses have been given to individuals, be it their first or second dose. It is understandable that people have questions regarding the vaccine, and that's why this video has been made today to answer 5 of the most common questions regarding the vaccine, such that if you haven't received it yet, you will be better informed regarding making a decision if you will take the vaccine or not. And if you have gotten the vaccine and you stumble across this video, this gives you more confidence regarding the vaccine you've received and what to expect moving forward. So let's go. So the first question is, will this vaccine give me COVID-19? The answer is no. There is no intact virus within the vaccine. During the production of the vaccine, they did not use any part of the actual virus itself. What they produced was the mRNA, which instructs your cells to produce spike proteins, which are those things you find on the outer surface of the coronavirus. And once your body produces this spike proteins and displays them on the external surface of the cell, the body begins to mount an immune response because it senses it as a foreign body. So note that the mRNA that's injected within the vaccine actually does not interact with your genetic structure or get into the cell nucleus, so it has no business with your DNA. All it does is instruct the actual cell to produce proteins that will be displayed on the surface, and that's what triggers the immune response. The mRNA itself is very fragile and can get degraded very quickly. That's why it is coated with some kind of fatty layer or lipid layer to protect it up until it does its work, and then it gets degraded by the body quickly. The second question is, this vaccine has never been used in humans. How do we know it's safe? The Pfizer phase 3 trial included about 43,000 people approximately, and the Moderna trial actually had about 30,000 plus people involved in the trial. It should be noted that the first individuals to get the vaccine were in March 2020, and as of right now, it is noted that most of the side effects that were experienced shortly after the vaccine was administered. As of today, we have an idea about some of the potential side effects. And yes, there have been few severe cases like people that needed an EpiPen or had respiratory distress, and they're usually noted to have had a history of severe allergic reactions, except in a few cases. But based on the allergic reactions that have been experienced and the severe anaphylactic reactions that have been experienced, recommendations have been given by the CDC and other health regulatory bodies regarding individuals that should not get the vaccine, especially those that have a history of severe allergic reactions or severe reactions to contents of the vaccine. Number 3, what are the likely side effects of the COVID-19 vaccination? Vaccination with the Pfizer or the Moderna vaccines have been associated with some side effects, the most common of which include pain and swelling or even redness at the site of the injection, but you also have other symptoms like fevers, chills, headaches, nausea, or generalized weakness. When I got my own vaccine, I felt the pain and the redness or even the swelling at the site of the injection administration, and I also had the generalized tiredness, but I did not have a fever, chills, or any headaches. Having these side effects are actually a good sign, as your body is actively mounting an active immune response against the spike proteins that your body produced following administration of the vaccine. The CDC has given some helpful tips regarding how to manage some of the symptoms if you do get them at home. If for some reason you have to take ibuprofen or Tylenol over the counter, you could also discuss with your primary care doctor regarding taking this medication, as it could help with the pain and also the fever you have. But regarding the pain at the side of your shoulder, you can apply a clean, cool washcloth that's wet over that area and massage it, and that helps. Or you could actually do some exercises and actually utilize that shoulder, as that also helps. Now regarding the fevers, it's also good that you stay hydrated and get some rest. If for some reason you realize that the pain and swelling at the site of the injection administration, which is usually in your shoulder, if it's been getting worse over a day, 2 days, and not getting any better, you might want to reach out to your doctor to figure out what's going on and see if there's any kind of medication you can be placed on to help you improve your symptoms. Also, if you know that you're still having like fevers, chills, nausea, diarrhea, you're feeling generally weak, and this is happening for an extended period of time, also reach out to your doctors and they can work with you to figure out how to get past these symptoms. Number 4, I already had COVID-19 or had a positive antibody test. Do I still need to get the vaccine? Right now, there have not been enough studies to show how long the duration of protection you get from natural immunity lasts. And when I talk of natural immunity, I mean like you actually got sick from COVID, or not sick, but you got infected by the virus and you now have antibodies. But if for some reason you got sick and you received the convalescent plasma or some other kind of antibodies during your treatment, it is usually recommended to wait 90 days before getting the vaccine. We know that when you get ill from COVID, usually within the next 3 months or 90 days, it is rare to find a recurrence of the sickness or the illness. That is why we think the natural immunity might last about 90 days. But it is recommended that you get the vaccine, as it is expected to have a longer duration of protection. Number 5, should children and pregnant women get the vaccine? Although the vaccine trials by Pfizer and Moderna were done across multiple age groups as well as ethnicities and genders, the children, pregnant females, as well as lactating females were not part of the study. It is noted that the recommendations for administration of the Pfizer vaccine was for 16 years and older, the Moderna from 18 years of age and older. And more studies have been done to include the younger folks as well as pregnant and lactating females. But the American College of Gynecology have recommended that females that are breastfeeding or are pregnant should not be excluded from the vaccination if they fall within the there's what we call groups that are recommended or highly recommended to receive the vaccine, which include females that could be frontline essential workers, or those that have severe comorbidities that can lead to severe life-threatening illness from COVID-19. So it is recommended that in these individuals, that if they are able to get the vaccine following discussions with their primary care doctors or OBGYN, should be allowed to take the vaccines. And finally, we've come to the end of this video. Hope this video is able to answer some of your questions regarding COVID-19, the vaccine, and if for some reason I didn't answer any of your questions on here, do not hesitate to drop this question down in the comment section, and I will be sure to answer them down there. If you haven't yet, please hit the like button, subscribe, and the notification bell to be notified whenever we release any new videos. I am the Whiz Doc. Thank you. Have a great day. Stay safe and stay healthy. Bye.